Okay, let's kick off this explainer with a question that might just make you do a double take. Is your website's appointment form secretly violating HIPAA? I know, it's a pretty startling thought, right? But it actually exposes this hidden massive risk that so many medical, dental, and specialty practices face when they just rush headfirst into digital marketing. You obviously want to grow, you want to help more people, but if your foundation isn't built correctly, your own website could literally be a liability. Welcome to today's explainer, where we're diving into healthcare digital marketing and how to build a rock-solid visibility foundation. Picture this ideal journey for a second. A patient is sitting at home searching on their smartphone. They're feeling anxious, maybe they're in pain. Your digital presence is what has to guide them from that worried little search right through the doors of your bright, modern medical practice, where your staff is ready to welcome them. But helping patients actually find and trust your practice, well, that requires a fundamentally different approach than generic local SEO. It's really about building deep trust before that very first appointment even happens.
So here is exactly how we're going to break this all down today. First, the marketing balance. Second, the HIPAA foundation. Third, the visibility pyramid. Fourth, content and trust. And finally, we'll look at the visibility score. All right, let's jump right into section 1, the healthcare marketing balance. Why does the medical field demand such a unique digital approach in the first place?
Think about it like this. A normal local search is super simple, right? It's just a city plus a general service. Plumber in Cherry Hill. Boom, done. But healthcare local search, that is a totally different ballgame. It's highly specific and incredibly high stakes. Patients aren't just looking for a quick service. They're searching by insurance networks, specific scary symptoms, provider names, exact distances, and office hours. For healthcare, local SEO is entirely about confidence. A patient absolutely needs to know your practice is legitimate, qualified, and safe before they ever even think about picking up the phone. It's not a simple transaction. It is a deeply personal decision. And that highly personal nature brings us to section 2, the HIPAA compliance foundation. Let's define exactly what is at risk here. We're talking about PHI, or protected health information. This is any health information that can identify a patient and relates to their care, payment, condition, or treatment. It is the absolute core of patient privacy. And the Department of Health and Human Services guidance is crystal clear on this. The HIPAA privacy rule gives people complete control over how this information is used for marketing. Now here's where things get tricky. When you're sitting with your marketing strategists, looking at those sleek, abstract dashboards and analytics, you have to be careful. Because everyday tools, standard analytics, retargeting pixels, chat widgets, call trackers, form tools, they can capture PHI casually if you install them without the proper agreements. Imagine someone typing their symptoms into your website's little chat widget, and that data is just passed along to a third-party analytics server without compliance in place. You've instantly created immense liability. The golden rule from our source material is simple but crucial. Do not install tracking tools first and ask compliance questions later.
So now that we've secured the perimeter, let's pivot to the actual solution in section 3, building the visibility pyramid.
Let's walk up this healthcare practice visibility pyramid together and see how it builds from the ground up. At the very base, step 1 is that HIPAA-aware website and tracking setup we literally just talked about. You cannot move up until that is rock solid. Step 2 is your Google business profile and your directory presence, essentially making sure your locations are dead accurate everywhere online. Step 3 is building out practice area pages and clear provider bios. Step 4 is all about patient reviews and intake optimization, meaning you make it frictionless to actually book the appointment. And finally, at the very peak, step 5. Content authority and AI visibility. You simply can't reach that pinnacle if the compliance foundation at the bottom is cracked. Every single higher layer depends on safe patient data handling.
Now, let's zero in on those crucial middle layers in section 4, content and patient trust. How do you actually connect with that patient sitting at home, worried about their health? The answer is practice area content. Now, this is content that explains a specialty or service in patient-first language. Absolutely no dense medical jargon allowed here. A single generic services page on your website? Yeah, that's just not going to cut it anymore. Say you're a physical therapy practice. You need specific pages for post-surgery rehab or sports injuries. You need plain English pages answering real everyday questions about symptoms, what the visit actually involves, and what the next steps look like. Clear, honest language, completely free of unsupported medical claims, is what actually builds that human trust. But here is a wild shift in the landscape. It's not just humans reading your site anymore. Patients are now literally asking AI tools for help, comparing providers, understanding their care options, and even preparing questions for an upcoming appointment. And guess what? Those AI systems rely on public Fox, directories, and your website content to figure out who you are. So clear provider bios, consistent directory listings, and well-written specialty pages don't just put human patients at ease, they actively train the AI systems that those patients are relying on. Basically, the clearer your public info is, the easier it is for an AI to recommend you.
Okay, so how do you know where your practice actually stands today? Let's shift from theory to practice in Section 5, the Practice Visibility Score.
To help you pinpoint your weakest link before you waste a single dime on ads, you can use the 100-point ThinkDMG Visibility Score framework. It's a great diagnostic tool that breaks down into 5 20-point categories. First up, website compliance readiness. This is checking your forms and tracking pixels. Second, local search presence, making sure platforms like HealthGrades and ZocDoc perfectly match your Google profile. Third, practice area page depth. Do you actually have plain English pages for your core specialties? Fourth, patient trust signals. Are your provider credentials and bios super clear? And fifth, your digital intake path. Because, let's be honest, all the visibility in the world means absolutely nothing if the patient gets frustrated trying to schedule their visit. So once you evaluate those 5 areas, you just tally up your score. If you hit an 80 or above, fantastic. You have a competitive foundation and you are fully ready to build content and launch ad campaigns. If you land somewhere between 60 and 79, well, you've got some addressable gaps. You need to repair your compliance, directory, or intake problems before you even think about scaling your ad spend. And if you are below 60, foundational repairs are needed immediately. The plain English takeaway here is super practical. Add up your scores, see exactly where you land, and fix the lowest area first. Seriously, don't buy more ads if your intake form is broken or non-compliant. To make this even more tangible for you, let's rapid fire through the highest risk gaps by practice type based directly on our source data. See if you recognize yourself in any of these. For dental practices, the most common gap is thin service pages. For physical therapy, it's weak specialty pages for specific injuries. Specialty medical, usually a lack of clear provider credentials online. For urgent care, we often see totally inconsistent location data across different directories. And for mental health providers, the highest risk by far is having highly sensitive intake forms that create massive privacy risks. Take a second to self-diagnose right now. Which of these blind spots might your practice be ignoring? I want to wrap up with this incredibly provocative insight from ThinkDMG. Do appointment inquiries from your website pass through a tool that has the right agreement in place? Honestly, a lot of practice owners simply do not know the answer to this. And look, that doesn't mean they did something wrong on purpose. It just means marketing and compliance have historically been treated as 2 totally separate conversations. But today, they can't be. I challenge you to audit your own foundation today. Evaluate your setup, check your tools, and just make sure that when a patient reaches out from their smartphone, you are building trust safely and effectively from that very first click. Thanks so much for joining me on this explainer.